next cranial nerve is the optic nerve, probably the most important of all the cranial nerves. It has three components that we test for. The first one is visual acuity, or how well we see. The second one is visual fields, that we see in all directions. And the third one is that the doctor sees well. The doctor can look in the back of the eye and with an ophthalmoscope and inspect the optic nerve. Can you see all right? Do you have any difficulty with vision, or do you wear glasses?
I wear glasses.
And do you wear them for reading, or do you wear them on a day-to-day basis for looking at everything?
On a day-to-day basis for everything.
Well, today we'd like to test your visual acuity, and to test your visual acuity, you should wear your glasses, in this case. Saki, I'd like you to put your toes to the line. This line is 6 meters away from the chart on the wall, and I'm going to ask you to identify the letters in some of the lines of this chart. I'm going to test each eye individually, so please cover your right eye. Now, with your left eye, please identify the following letters.
Z, J, P, E, A, O, U, D, P.
Saki, I'd like you to cover your left eye. So with your right eye, please identify the following.
X, C, P, N, D, P, J, O, U, D, P.
His vision, according to the Snellen chart, is 6/5. What that means is that he can see at 6 meters, something that a normal person can only see at 5 meters. In other words, his vision is actually better than normal with glasses. Let's say that Saki couldn't see the big number here, which is N. Please take a seat. So, the next step then is to determine if he has any vision at all in his eyes. In order to do that, we can ask Saki to identify fingers. Please tell me how many fingers you can see.
2,
How many fingers you can see.
3,
He now can count fingers at 1 meter. Let's imagine he couldn't even count fingers at 1 meter. Our next step would be as follows. Saki, I'd like you to tell me when you see my hand moving. Saki correctly identifies hand movements. Let's imagine he can't see hand movements. Please look at me. Can you see a light?
yes,
Can you point to the light? There. So Saki, vision is impaired, but he's able to see light. The next step with examining the optic nerve is to check that Saki sees in all directions. That is visual field testing, and it's called confrontation. I'm seated 1 meter away, and I elevate my hands to the horizontal position, and then, Saki, I'd like you to identify when you see my finger moving. Please remember, when you test the eyes by confrontation, you only test the temporal visual fields. In order to test the nasal visual fields, you have to test each eye individually. Saki, I'd like you to cover your right eye. The examiner also covers his corresponding eye, which is his left eye. Please look at my right eye and tell me when you see my finger moving. So in order to test for visual perimetry, you have to come from behind the patient's visual fields, and we do that in convex arcs, as it were, from northeast to southwest, from northwest to southeast, and also in the reverse direction. We do it in the following manner. Tell me when you see my finger moving. Tell me when you see my finger moving. Tell me when you see my finger moving. And tell me when you see my finger moving. We ask the patient, please look in the distance. Now, you hold the ophthalmoscope in the right hand and you approach the patient from approximately 30 centimeters away. The important thing to remember is that you approach the patient in the same horizontal line as the patient's visual axis. That means in the direction the patient is moving. You hold the ophthalmoscope in the right hand and you look in the right eye. When you look through the lens of the ophthalmoscope, you will see a red pupil. That's called the red reflex. The light is being reflected from the retina. That is normal. You look through the ophthalmoscope and you approach the patient and you move to within 2 centimeters of the patient's right eye. And you will be able to focus on the optic disc, and then moving the light around the retina, you'll be able to see the blood vessels and the retina. And the next cranial nerves together are the nerves that are responsible for eye movements. Between those two nerves, we examine the pupillary reflexes. The reason for that is that the afferent arc of the light reflex is in the optic nerve and the efferent arc is in the oculomotor nerve. So this is where pupillary reflexes are examined. There are 3 pupillary reflexes. There is the light reflex, there is the accommodation reflex, and the consensual response. Saki, I'd like you to stare in the distance, and with a bright light in your right hand, you shine a light on the patient's forehead, just at the bridge of the nose. The reason is that you want to inspect the pupils at rest. And in this situation, Saki's pupils are central, circular, and symmetrical at rest. In other words, they look normal. In order to test for the light reflex, you test in the following manner. You hold a bright light, and you bring the light in from behind and shine it on the pupil and look at the response of the pupil to the bright light. In this case, Saki's pupil has reacted briskly. In order to test for the consensual response, you just repeat the maneuver for the light reflex in the same eye as follows. This time, you look for the response in the left eye. In order to test for the accommodation reflex, you just very simply ask the patient to stare in the distance. Saki, please look in the distance. You elevate the eyelids slightly. Hold your fingertip approximately 10 centimeters away from the patient's nose. Saki, please look at my fingertip. If you look carefully, both eyes adduct and the pupils constrict. That's a normal accommodation reflex.